A very warm good evening to you. It's truly a warm evening today. कुछ ज़्यादा ही warm है. So welcome to you all. We're having this discussion on coping with diabetes, um, daily, everyday strategies, and long term. How do we cope with this? Once we are detected with diabetes. So, welcome to a session which is brought to you by TRIOMPH. TRIOMPH is an acronym for Transplant Recipients of India and Organ Failure Patients, a movement to provide hope. The patient support group by MOHAN Foundation, which is an NGO. TRIOMPH is a patient body essentially for you, by you, and of you. Thank you for joining me, Jaya Jairam here. We're joined today by two remarkable women who live with different forms of diabetes, but they share one trait: resilience through lived experience. So let's explore how they manage their health, make smart choices, and inspire others along the way. Before we dive into the discussion, let's set the context for today's discussion with some sobering facts. India is currently home to over 100 million people who are living with diabetes. And according to recent estimates from the ICMR, alarmingly, this number is expected to rise to 134 million by 2045, therefore making India the potential diabetes capital of the world. Even more concerning is that nearly half of these individuals, they remain undiagnosed, which increases the risk of long-term complications. So uncontrolled or poorly managed diabetes is a leading cause of kidney failure, contributing to the growing burden of CKD or chronic kidney disease and the need for dialysis and thereafter kidney transplants. It is also a major risk factor for cardiovascular diseases. So, given these staggering numbers, today's conversation is more vital than ever, and we hope that it not just sparks awareness, but also action in terms of self care, support, and solidarity to one another. It gives me great pleasure to introduce to you the panelists for the day. We have Nupur Lalwani. She's been coping with type 1 diabetes. She's the type 1 diabetes advocate and a founder of Blue Circle Foundation, which is an NGO and a support group for families and people living with all types of diabetes. Hi, Nupur.
Hi, Jaya. It's a pleasure to be here. Thank you so much, and really look forward to our chat with you and Dr. Subha.
Thank you. We also have Dr. Shubha Murthy, who is a kidney transplant recipient of more than 20 years. I'm going to ask her exactly how many years she has completed after this. And she's been coping with post-transplant diabetes. She's a MBBS doctor herself, so she wears both the hats of being a doctor as well as somebody who copes with the disease. Let's now begin with, I didn't say welcome to Shubha. Hi, Shubha. Welcome, Shubha.
Thank you, Deya. Thank you. Thank you for your kind words. And it's a very important topic you have chosen
Yeah,
this time. I'm very
sure.
happy. Yeah.
I'll request the host to spotlight all three of us, so that we need not keep switching. All right, let's now begin with the discussion on. First, I thought it would be good to discuss on how do you manage diabetes? How do you do this on a day-to-day basis? My first question is to Nupur. Nupur, you've developed an incredibly smart and tech-savvy approach to managing your diabetes. What does your daily routine look like now, especially when you are traveling? So, could you kind of touch upon the dietary patterns and what principles have worked for you well? What tools and devices have become an essential part of your diabetes management? Over to you, Nupur.
Thank you, Jaya. That's right. And Jaya and I also met on one such event where we were traveling and in a whole different location. It is very challenging for us as patients to manage our condition. Actually, to be honest, for a person who doesn't have diabetes or kidney disease, also it is quite challenging to maintain, to keep that discipline going. But for us, I think there is an extra layer of difficulty difficulty because there are so many things we have to balance, right? We have to make sure we're eating healthy, we're eating something safe. And I think these are some commonalities I noticed even between, Jaya and me. We were both quite particular about what was going on our plate. So that's a constant kind of pull and push. So what I try to do is, I know that stress, travel, these things are inevitable. They're part of life and I cannot avoid it. I have to live my life as normally as possible. But because I, over the years, since childhood, I've had type 1 diabetes, which means that I take insulin injections around 4 to 6 times a day. And I check my sugars on a glucometer or a CGM. So if it's a glucometer, I'm checking between 5 to 7 times a day. Or now there are devices like CGM, which I'm happy to quickly show you on the screen. So there's this device that you can see here on my arm. It's a sensor that reads the blood sugar reading and it tells me the sugar reading on my phone. So when you spoke about tech, that's the one of the things that came to my mind that I want to show and talk about a little bit, because it makes the life of the patient a little bit easier. There were phases in my life growing up where the teenage years or the difficult years where I didn't want to check my sugar, and family would be like, did you check? And I'd be like, okay, yeah, I checked. But actually I wasn't checking. I was lying to the doctor, I was lying to my parents. We all go through these phases, whether we are young or whether we are much older also. So I did all of those things, and eventually I came to the realization with a few hard knocks that this is not the way forward. I have to take charge. So now I feel quite strongly about maintaining my own, blood sugars, and I definitely use the help of technology. We actually, as a patient group, created a mobile app. It's called Blue Circle Diabetes app, which all of you are welcome to use. It's completely free of cost, available on Android and iOS both. And it really helps track your blood sugars, because there's a lot of data that goes into diabetes management. You need your blood sugar, you need your weight, you need your HbA1c. All those data points can really seem overwhelming. So I think we must use the tools these days. Of course, there is a lot of talk about AI. So we must, smartly pick and choose and use the things that benefit us as patients.
Nupur, can you also talk about the diet management that you do?
Yes.
I mean, what are you mindful of when you're, especially when you're traveling?
Yes, yes. So Jaya, since the last, I think almost 10 years now, I've modified my dietary pattern a little bit to, have a little less of carbohydrates and a bit more of protein. Because for me as a diabetic, the one thing in the food, and it takes me back to school, and I guess I wasn't paying as much attention back then, in school when the teachers were talking about carbohydrate, protein, and fat, and all of these things, and you just see food as a whole. But when you observe what is it that is spiking your sugar, I've noticed that the carbohydrate really spikes. The sugars in our Indian diets are very rich, at least 70% carbs. We are having, wheat and jawar and bajra and rice and whatnot, and, maybe just a little bit of dal or, some eggs or some chicken or something. So I've transitioned a little bit in the last 10 years to make sure I'm getting sufficient protein and reducing the carbohydrates. So when I go out, I try to follow the same system. I actually, my goal with traveling also is to keep the same, as close to home as possible. So if I'm used to exercising in a certain way at home, I'll at least try and do half of that. Maybe go for a walk if I'm traveling, or eat something similar. If I eat an omelette in the morning, I'll do the same thing when I'm traveling. So these small things help me stay on track.
Lovely. Thanks for sharing. My next question is to Shubha. Shubha, well, post-transplant diabetes kind of adds another layer of complexity to the already so many things that we are trying to balance and get life going. So, how different is post-transplant diabetes as compared to pre-transplant diabetes? And, personally, how have you been managing your routine in a sustainable manner?
So Jaya,
Yeah.
post-transplant diabetes. Let's talk about post-transplant diabetes. So there are two things. There is diabetes in general population, which is type 1, type 2, and during the pregnancy. And there is diabetes before the transplant, or he had a diabetic nephropathy and lands up in ESRD, that is end stage renal disease. Okay, so this there are these patients who are in, and there is post-transplant diabetes. So for transplant people, there are two types. There is pre-transplant diabetes, which the person was already having diabetes earlier, and there is something the patient has developed diabetes afterwards, which was initially called as NODAT. But nowadays the term is not used. NODAT is new onset diabetes after transplant. So that word is no longer used, but we use it PTDM, that is post-transplant diabetes. So that's the word that is commonly now. Recently, we have been using that word. So I'll stick to PTDM. So the name itself shows that we're talking about post-transplant diabetes. I'll touch upon the pre-transplant also while speaking about post-transplant diabetes. So how different is it from the pre-transplant? So first, let me tell you that post-transplant, once you know why we have developed post-transplant diabetes, you'll easily come to know why it is different from the pre-transplant diabetes or diabetes in general. So post-transplant diabetes is after transplant, when we are all rebuilding our lives, we are off dialysis, we are basically off having a good feeling very good because of the medications that we are taking, and we have been told to rebuild our lives, get back to the job. So we are getting back to the job and everything is, we are relieved about, there's a lot of hope, we feel better. So all these things make our lives quite good
Good.
after transplant. Yeah.
I call it the post-transplant euphoria.
Euphoria. It's actually euphoria. And that, why is that euphoria there? So it's a steroid induced euphoria. So it's because of the steroids, the medications that you take. And this steroid is the medication, usually what we take is steroids and the immunosuppressants. The steroid is the greatest contributor for hyperglycemia. And the second cause is the immunosuppressants. So how does steroid induce hyperglycemia? It's very simple to understand. So if you understand this, you will never, you will make sure that you are following all the diabetic management. So what happens with what happens with the normal glucose metabolism? And one more point, yes, I wanted to, the incidence of PTDM is more common with kidneys. It can range from 10 to 74. Various studies have given different ranges. So let's go with the average, that is 50. 50% of the patients can develop post-transplant diabetes. So, okay, and heart transplant people, 11 to 38% develop heart. Now, this I've got it from one of the nephrology articles. Okay, so and liver is 7 to 30% of the people will get PTDM. Lung.
But this is very important information to share because if you've not been mindful of it, then you
Yes.
should be more mindful of what you're putting in.
Yes. So around 30 to 50 in every organ transplant, around 30 to 50 is, if we can talk about looking at this figure. 30 is a little more for liver and lung transplant, and kidney 50. So around 20 for rest of them, heart, liver, and lung. So why does this happen? This happens because normally what happens is normal glucose metabolism. You have the food that you take in, it just turns into glucose. Now what happens to the glucose has to go somewhere. So what happens to this glucose? Glucose then enters into the muscle and the adipose tissue. So to enter into this muscle and the adipose tissue, the door has to be opened. The door of the muscle and the adipose to be opened, which we call it as receptor. But let us call it a door because we are not medical people here. So they have to be opened. So how does this door open? This door is opened in the presence of the insulin. Insulin helps in opening the door and making the glucose get utilized to the muscle and the adipose tissue. So here there are three things that are playing a role. First is the insulin. Second is there is hypoglycemia. Third is the door on the muscle and the adipose tissue. So whatever you eat leads to hyperglycemia. So whatever you eat leads to increase in the sugar in the, let's not call hypoglycemia. In a normal person, it's not hypoglycemia. Increase in the sugar. The moment there is an increase in the sugar, these doors open in the presence of the insulin and it is utilized. So what happens with a person with diabetes? So post-transplant diabetes, the steroid blocks this receptor or block the door of the muscle and the adipose tissue, that is fat tissue. So the steroid plays a very big role in blocking this dose. And what does the sugar that is formed, the food that we eat, so the sugar that is turns into glucose, and the sugar is filled up in the blood, and what happens to it goes on filling up with the blood because it is not getting utilized. So when it is not utilized, it stays in the blood, and that is hyperglycemia. So now what happens with immunosuppressants? What does immunosuppressants do? Tacrolimus, sirolimus, and cyclosporin. All the three are supposed to be induce beta cell insufficiency. So what do you mean by beta cell? The beta cells are slowly dying. So the amount of insulin that the patient was uh, insulin that was secreted before transplant is less after transplant because of this immunosuppressants that you use, and because of which the insulin that is secreted is less because number of beta cells are less. Okay,
Right.
it is something like type 1 and type 2 diabetes. Type 1 plus type 2 on top of it, type 2 is what is post transplant diabetes. So type 1 is when the patient, like Nupur and all, they have this autoimmunity, which because of which the beta cells die. And
Yeah.
type 2 is lifestyle disorders because obesity, dietary dietary problems, lifestyle problems, obesity, smoking, all these do not allow the receptors to open, the door to open for the insulin to be utilized. So we are talking now about post-transplant diabetes, which is both type 1 and type 2.
Right.
So for
And it
this,
is basically induced by the steroids as well as the
steroid,
immunosuppression medication that we are taking post-transplant.
steroid plays a much more bigger role than the
Bigger
immunosuppressant.
role.
Than
Yeah,
the,
yeah,
and steroid has a typical when steroid induced diabetes is typical, has a typical glycemic pattern, that is post meal it is increased.
yes,
Okay, so why am I telling you this is, so what do you do? So what do you do when you want to diagnose post-transplant diabetes mellitus? First and the foremost, there are some factors that you have to, risk factors that you have to look into. If you are a patient who has a family history of diabetes, you are a patient who have genetic predisposition, that is for diabetes, or you are a patient who was pre-diabetic earlier, you were diabetic earlier, or you were borderline diabetes before transplant, all these patients should be very careful after post transplant, and they should get their tests done very regularly. Of course, your nephrology clinic will definitely help you in all these things. My only request is, because you know these details, please make sure you don't miss those tests.
yeah,
These tests will be told to you by your nephrologist, but most of the time what happens is people tend to miss it, especially if you're having this history. Every 3 months, you have to get your HbA1c level and postprandial blood sugar level, the post-lunch blood sugar level. And for fasting blood sugar level, when you're doing this, you also do fasting. Usually, initial period, the fasting is usually normal. So postprandial is the most important. So the complexity that is added to this is, already we are taking so many medicines
yeah.
uh, for our transplant. We have been taking the immunosuppressants and all these things. On top of that, diabetes, it leads to one more addition of
Layer, yeah.
one more
So, Shubha, if you could now talk about how do you manage it as someone who
yes.
is living with post-transplant diabetes?
Yeah, it was all for me. See, I'm now 21 and a half, more than a half years of diabetes. So what
Oh,
happened?
diabetes. I thought transplant.
Not, sorry, transplant,
Yeah.
and 2011, so 13 years of diabetes. Okay,
Okay.
so 13, 14 years, yeah. So it all started with, as usual. So there is a little bit of denial. I can do it with my diet, I can do it with my exercises.
Yeah.
Yeah, that happens. So the best part about this management of diabetes is diet. First it is always diet and exercise. Now, why am I diet is, of course, you have to take low carb, because you want the glucose in the blood to be in the lower level, because you don't have that much of insulin, you don't have the doors that are open, and The diet has to be very regulated. Second thing is exercise. Now I want to again, the reason why I've told you the how it develops is because exercise. What does exercise do? Exercise helps in opening those gates. So they open the gates for the glucose to go in. So for me, having known all this, it took me some time to get used to the whole thing. So because I come from the southern part of India, absolute rice eater. So, and I was also in Hyderabad during that time. So, being a rice eater and being in the south, for you to change
Your
suddenly
habits.
is very, very difficult. And if you're staying in a joint family, it is much more difficult. So, everybody has to be on board as far as this thing is concerned. And to get and help to get the chapati, I didn't know how to do chapatis. Within 1 year of my transplant, I started working. So getting a help for a chapati was also difficult. But gradually, the most important part is, what I did was I kept my thali the same. I just reduced the amount. I did not change
Can you
new diet.
get into that a bit, Shubha? What did you mean by you kept the thali the same?
Yeah, so the I used to have rice, sabji, dal, and curds. So I kept it like that, and a little
Okay.
bit of chutney, achar, and all those things. So I kept it like that, but I reduced the amount. So
Quantities had to
I
be
yeah,
focused.
yeah, reduce the quantity, the portion that you eat. So reduce this, increase the others. Dal was
Sure.
increased. This vegetables were increased, and 1 cup of curd remained the same. So when you reduce this amount slowly, you have to do it gradually. And after about, when I reduced this to half, I started feeling hungry. It would not satisfy me, even though it was a very gradual thing. Because when you're eating rice, immediately you feel that fullness. That
Yeah.
was not, I was not getting that. But then I was working. I had a small child, 4-year-old child, running around with her for this class, that class. Everything was going on, and that is the reason I was even feeling more hungry. So what is it? So I the thing I did is that I started splitting my lunch into breakfast. I skipped my instead of having a typical idli dosa type of a breakfast. I started having chapati roti, and then in the evening one chapati and rice, one chapati in the morning. So that was much better. So by the time we came to Mumbai, and then Mumbai, getting a house help for a chapati is much easier. Then that is how I did. For in the morning, I used to have. That's what. This is basically I split it into the food. I split into two, and then in the afternoon, of course, there were some. I was used to a little bit of snacks, and that getting down on those snacks was again very difficult because I would get hungry. There was time where I used to take my daughter to classes and all those things. Then evening, of course. So my point is reducing your portion, that is whatever portion you are in, especially the grain portion, and increasing your vegetable. And the difference that Nupur and I will have is she will eat fruits, she will eat cut vegetables. All the salads and the fruits are allowed for her. For us, we don't have that portion which will fill our stomach. We have to have home cooked meal. So that is where we struggle. When you are very hungry, there is nothing but food to eat, home cooked food to eat. Or some snacks like poha, some proper cooked item like a poha or something. Then slowly you learn a lot about sprouts. Then you switch on to sprouts. The dal increases. Then you recently have started Greek yogurt, so even that, using that with some vegetables and all for the afternoon. But this is a very slow process that by the time I started with 6 units of insulin. And another point is post transplant diabetes usually end up with having insulin. So the oral diabetes only lasts for a year or two. So we usually end up having insulin. So started with 6 units of insulin. Now I have to increase it to um, 26 units, spread across, of course, 3 times. So
So, Shubha, I'll just come back to you. So, my question to Nupur is, um, Shubha shared a very important point in terms of, reducing the quantities, um, being a little bit more mindful on protein intake. But as a layperson, as someone who has never been too conscious about these things, can you guide us on how do we look out for, uh, you know, like a normal curd versus a Greek yogurt? So how do you recognize that, okay, this thing is more beneficial? Some slight tweaks, how do we incorporate that into our diet?
Yeah, I think Jaya, that is such a important question, and even what Dr. Shubha said about those small things and gradually making those changes really vital, because sometimes you get shocked with the diagnosis and you take a long time to accept it, and then to make changes takes another 20 years. So like sometimes it's just a matter of but I think the first thing, like before we even look into the food or anything, is that as a patient, you have to have the will to change. You might have the best doctor, you might be going to the best hospital, you might have everything good going for you, but if you don't have that nature which is proactive, that yes, this is my body, I need to take care, nothing is going to happen. And I speak from personal experience, because I had the best of everything and still I don't think I made anything of it, until I got a fright. And actually it was a fright related to the kidney, so one of my reports came in a little off, and it really freaked me out. So for me, it's been 29 years living with type 1 diabetes now. My kidneys so far, touch wood, are fine. But 7 or 8 years back, one of the reports, the numbers were a little off. So that was actually my wake up call, for me personally. And I realized that, and then I went on to do a 24-hour micral urine test, this, that, and other. It came clear. But those 3, 4 days that I lived in doubt of what might be happening to my body, to my kidneys, that for me, actually, unfortunately, failure of some sort of fear of failure was the reason I was able to turn around and change things. So I guess what I'm trying to say is that we have to be proactive enough to learn. Most of the patients, at least that are part of support groups, are educated enough to read the back of the packet. Whether you do have an idea, you do have access to Google to see that how many carbohydrates or proteins are there in XYZ food. So that is something to look at. And nowadays, even general lay people are looking at, there's an influencer called the Food Farmer. Maybe some of you have heard about him, and he's talking about how he got into, I think, a lawsuit with one of these Horlicks, Bonvita type of companies, saying that it has a lot of sugar and it's not safe for children and others. So knowing all of these things and then seeing what works for you is very important. We are surrounded by friends. We are lucky to be part of a support group like the one that you're running, and we have access to doctors, to support. We have everything. The only missing link is taking charge and finding out what is a good option. And I think that when we discuss with our peers and our friends, we have some learnings, because we speak the same language. The doctor might tell us something, we may or may not at that point listen to the doctor. And I can imagine how frustrating it would be for the doctors as well. But I think that very, very important to share openly our failures, our successes, because that's the only way forward. And for me, I think I begin to pay a lot more attention. So even now, I will not put anything in my mouth as long as I don't know my blood sugar. Like for me, it's very vital that if my blood sugar is normal, only then I will go ahead and eat something. If it's not normal, I'll take my insulin. I'll wait for however long it takes for my blood sugar to come down. So these small things, and if for example, I'm going out or I'm traveling, there's that extra layer of planning and a little bit of complication, because if we are sitting with friends, we are at a table, the food has come in, and I realize that my sugar is high, it's like 180 or something. At that point, it's a little awkward, in these kind of situations, that should I wait now, other people will eat. But I think it is a little bumpy sometimes, the ride, but it is really crucial to sometimes we also feel shy, like we feel like how can I ask the host if you're going to somebody's house? People, they sometimes ask, do you want to eat something specific, or sometimes they don't ask. But we feel pressurized because of these social and family situations, and the way I've sort of managed that over the years is to pick and choose what works for me. So I don't want to burden my host. So I don't ask for anything additional, but I will take what, if there are 6 dishes, I'm sure at least 2 or 3 will work for me. There'll be sprouts, there'll be some vegetable, there'll be some curry, or there'll be something that I can have. So I pick, and calculate based on that, and then I check my sugar post meal, so I know whether it worked fine or not.
Valuable, very practical tips there, Nupur. Now, we've spoken about the disease as such, putting a lot of emotional and burden and causing, mental health. As in, अरे यार diabetes भी हो गया, दवाइयाँ शुरू करनी पड़ेंगी. So, and then the next, if the person is told to start taking insulin injections, and that's another bigger layer of burden that comes on. So, how do you, Shubha, my question is to you. I want to ask you that, um, especially management of transplant care and diabetes care can be emotionally pretty demanding. So, how do you cope with this? Any coping strategies that have helped you over the time?
So, so every person, for every person, I think it's different. So if you actually look at it, coping mechanism is very, it depends on your attitude also. The most important thing is it depends on very much on your at how you look at life. So initially, as I said, when you're rebuilding your life and all, it's all fine. And then when this diabetes sets in, you have some more financial problems, emotional problems, anxiety is surely going to set in. And especially if you are, getting, you have a family and all, it becomes more difficult because you have to run to the doctor's appointment, you have to get your tests done, you have to look after your, I was doing a job, I was also doing a job. So all these things, of course, anxiety is going to develop. But what I felt was doing a job was more important for me. It just made me feel much better about myself. So, what I would advise everybody to is that please get back to what you were doing earlier, because that is the whole purpose of transplant. So you getting back to what you are doing, whatever, if it's either it's your job and whatever hobbies you are doing, even if you are not a person who is doing a job. Now we will be, must be having a very varied audience right now. Some would be doing a job, some would have retired from the job, some would be a student, some would be a housewife who must be having a hobbies. Some, so for, the most important thing is to get back to what you were doing earlier. If suppose you were when you were young, when before transplant you were getting into music, do that. If you are into sport, do that. If you are into studies, continue your studies, get back to your studies with all the precautions, all the precaution your nephrologist. So similarly, I got back to my job, which I thought made me feel good about myself, because after going through end stage renal disease and the surgery, post surgery, you feel good, but after a couple of years, your anxiety sets in. So then that is one thing. Second thing, what I felt is that after a few years of even after doing the job, I don't know, everybody has their own. My job was not making me really happy. The place where I joined itself
So
had
more
issues.
stress then.
So that is, I went with the thought that it's going to make a meaning to me. So they were having some issues within when I joined, but and after I joined, I realized that it was very stressful for me and kind of a toxic environment, because if sometimes some people will give you a little bit of a leverage because you are going to have gone through something. Some are not like that. सो दे तू तो अच्छी दिख रही है, तू तो सब कुछ करती है, तो ये भी कर, ये भी कर, ये भी कर. That happens, and being a very sincere person, it happens more. So that is another thing. So what I did was, it took me 3.5 years for me to leave the job. I tolerated it for, and during that time, my husband tells everybody, in that 3.5 times, she was admitted 6 times. That is what happened with me. I was admitted 6 times. So then you always have to ask yourself at every stage of your life. Now I'm talking about 21 years. So I have gone through all these things. So, but every stage you have to ask that, am I doing the right thing? Am I
Yeah.
feeling happy? Is this bringing me a lot of joy? That's the question I had to ask myself. And financially, you feel that, no, I have to. I'm going to pay for my medicines. I should pay for my medicines. I've got educated. Why can't I pay for my medicines? So the question that I used to have a problem with in the early part of my transplant was, तुम तो डॉक्टर हो, तो पता नहीं चला. It was so difficult for me to get through that. Then now what I go through is, like, I feel myself. I have worked so hard. Not only that, I have done my DNB. DNB is a very tough exam. So I have worked so hard to get here. Why am I not doing anything? So it took me a long time to get over all these things. And the biggest help that happened was, I started taking up hobbies. So that helped me a lot. That started making me very happy. I started sketching. Then I started learning Hindustani music because I didn't have any Carnatic music nearby, because that was something which was there in my house. But I said, I'm not looking out for somebody going far away and then getting my music classes, going for my music. There was one lady right across my building. So I went to her, and even till today, I was very bad. I couldn't sing a note. But now I'm at least not bad, but not very good, but somewhere in between. So that the fact that I can sing, at least kitchen when I'm singing, people are not doing this, is itself more better. This joy, it's a very big joy. It was such a big joy for me. So similarly, what I feel is, whatever you feel good,
Do that.
do that. And whatever you feel, sorry, whatever gives you some meaning to your life, or something like that, like job, or whatever gives you joy, because
Wonderful.
ups
Yeah.
and downs are a part of a transplant patient with diabetes.
Mhm. True.
So this is one way
Thanks
I
for
cope.
sharing, Shubha. Yeah. My a similar question to you, Nupur. You are the founder of Blue Circle Foundation, and I'm sure there are so many people who are part of it. So, what do you find helps most people in terms of building emotional resilience, especially on a bad day? What helps you reset your mindset and keep going?
I really enjoyed listening to Dr. Shubha, and it's so amazing. I just want to take a second to also acknowledge that my friend Snehal she's also joined the call today. She also lives with type 1 diabetes, and, she leads our community. And like you were saying about classical music, she's learned classical dance as a child. She also has type 1. And now she does, I don't know, all kinds of, many multiple forms of dance, some of which the names I don't even remember, but I think it's so crucial, right, to find what gives you joy,
Yes.
be it work or hobbies, and actually both things together also. For the community, for Blue Circle, I've noticed that for people, we all feel like, something has really gone wrong with us when we are diagnosed, and some of us are maybe we are too young when we are diagnosed, so our parents and our families go through that. But and we all feel like we're completely alone in this world. I remember my parents saying for many years that they felt like I was the only child that had diabetes on this planet, even though they
Yes.
knew others are there. Like, we were lucky early on, we had some support, but still they felt that, and that's so sad because everyone goes through the same thing. So I think one is that having that sense of community, just being with other people, not necessary. Some people are a bit shy or introverted, and that's absolutely fine. So even if you want to be on the group or on the call or in the video and you don't want to say anything at all, that's okay. But just show up, because you're not showing up for Jaya or for Dr. Shubha, you're showing up for yourself. I
Yeah.
mean, of course, we are going to like it if you're there, but like coming is the biggest thing, and that keeps you kind of active. And I know Snehal also says this a lot, like every few months or once in a year, like if she's feeling down, she needs to just go back to the group and start a chat, and then you're feeling back and buoyant again. So I think the community aspect of it is really important, and even though it might not sound as fancy or scientific or whatever, it really makes a difference when we spend time with our friends and family. Same way, when sometimes our families also don't understand what we are going through as a patient, right? It is very isolating, to be part of the
Yes.
same
Yes.
unit and still, like, you know that you love your family, but you also know that they don't get it. So
Absolutely.
it's really crucial to develop those friendships. And there are people I've made friends over the last so many years whom I've never met in my life. They're just online or just on WhatsApp, but I know that if something happened, like, I would be there for them, and I know that they would do the same for me. So I think community is one. Second is physical and mental health are so linked, right? Like sometimes we feel like it's okay, I'll just it's important to just focus on my mental health, and yes, that's true. But sometimes just getting out, going for a walk, or just doing something for yourself that involves taking care of your body also, like, supports your mental health. So I think that is also really important to kind of realize that there's a balance between the two, and I cannot have one without other. So maybe go for a coffee with your friend someday, or meet up, or something. And I think yeah, I think these having this balance, and of course always being in touch with your healthcare professional, following the advice, and remembering that it's not that somebody's giving you a lecture, or it's not something like that. It's for your own good. So for some people, like for me, I'm a very curious person. I want to know the why of everything. So sometimes I'm sure I irritate a lot of people because I'm constantly like, but why like that, but why like that, but like some of us are like, we all have different ways of teaching ourselves also. So for me, it is very important to know why. If I know why, then I'll do it lifelong, and I'll like be the most sincere person. But if somebody tells me, no, you have to trust me, I trust you. But
Yeah.
like, to realize that even as people we are different, that also comes into play.
Correct. Correct.
Good
Correct.
scientific
Absolutely
approach,
right.
Nupur. You have a
Yeah.
very good scientific approach. That's the reason I told you about the steroid and went into that detail. I think all the audience also should, if they understand that, they will do it better. Very nice, very nice.
Great, great. Really, this is so heartening that we are discussing. We're actually opening up and discussing over here. So I also want the audience to interact. So before we open it up to the crowd over here, I just wanted to ask you both. Shubha, what is one lesson you hold on to when things get tough, and what is a message that you want to give out to the community, to our community of recipients, people who are dealing with organ failure? So one message that you would like to give to them.
So all of us have gone through the same thing. First thing is, all of us have gone through the transplant. Its ups and downs in different ways. I must have gone through some other problem. You must have gone through. Others have gone, but we have gone through a huge ups and downs. So anxiety, feeling a little low, depressed is a normal thing. I don't think it's if you're feeling very anxious, that's wrong. No, the what you have faced is a biggest challenge in life, very big, and not only for a day or two, for days, every day, because every time you go and give your blood, there's an anxiety there. कि क्या होने वाला है? वो blood का report क्या आने वाला है? Today it comes 1.6, 1.7. The next report they'll tell you to take it after a week. So is it going to be 1.8, 1.9, or is it going to be 1.5, 1.4? So these anxieties are there all your life, but please don't lose hope.
Yeah.
Please find joy, find something that you're very happy about. And as Nupur correctly said, even I do the same thing. Initially, when I used to wear a mask and all those things for the first 3 years, people used to isolate me. I was in like, they if there is a wedding or the function, वो तो नहीं आएगी. So they would not call me. Then I had started telling, because see, I'm talking about 2003, 2004, when transplant itself was done in a very handful. Awareness was near nil. There was no social media. So I'm talking about that time where there was no WhatsApp, no social media. Anyone wants to know about transplant, they only know that ये कुछ तो हो गया अभी ये तो 5 साल से ज्यादा रहने नहीं वाली है. So that type of a thought was there. I wish someone told me that you're going to stay 20 years. I would have lived much better. So,
You know, Shubha, you give so much of hope to
exactly.
everybody else. 20
Um,
years post-transplant is not a
yeah,
joke.
I'm
And
so happy, Jaya, you have this group just because all the rest of the people will see me, will see so many people who have transplant 10 years, 15 years, 20 years. And the only thing I tell them is please hold on to your hope. There is always hope. Your creatinine will go on fluctuating. You will have n number of problems. You will be admitted so many times in the hospital. You are going to bounce back. Keep that hope. I'm going to bounce back. So you are going to bounce back. You are going to have a good life. And whenever you are at home, so बहुत दिन से दिखी नहीं शुभा. So when you don't see me, I'm not well. When you see me, I'm always roaming in the complex. So that's in the evening from around 6 o'clock to 7 now it is. Otherwise 5:30 I'm always there. So when they see me, they say, "Oh, Shubha is fine today." So I've been staying in this complex for the last 16 years, so everybody knows me. So that's how it should be. My point is, what Nupur has said, correct. You go, and then when people stopped calling me, I would tell them that please call me. When I come to know that there's a wedding there, so I would tell them, no, I'm coming. Then they would be so anxious. Their anxiety is more than my anxiety. What are you going to eat? I'm telling, I'm talking about 2004, 2010 and all. So what are you going to eat? I can't give you anything. You can't eat all this. I bought my dabba, I'll tell. Those days I used to take my dabba around because I was not very sure about all the things. So there was awareness was less, and the whole importance that time was about graft survival. No nutritionist, no mental health person, nobody to tell you anything about. Everything resolved around graft survival. So
true.
what I tell them is keep that hope, enjoy life, so that positivity leads to a lot of more positivity. Life
True.
is good.
Thank you. Thank you, Dr. Shubha. Thank you for sharing that. Now, my question is to Nupur. Can you please share 3 practical tips for sustainable and empowered self-care? Self-care, especially while coping with diabetes, self-care is so important. And you can't just take a back seat. So, as an advice for someone who has just been diagnosed with diabetes or who is in denial, if you can uh, give 3 practical tips.
Yeah. I think the first one would be that, like, along the same lines of, Dr. Shubha, you can do it, you are enough, because many times we don't know what we are capable of until that burden is put on us. And unfortunately, we didn't choose this, but it's happened. So
Yeah.
now we have to deal with it. So, you have no option. You have to carry on. You just take one day at a time and, cry to your heart's content, do whatever you want, but wake up next morning and start again. The second thing I would say is that, some self accountability, like the buck stops at you. It's not your doctor's job. It's not your spouse's job. Many times I know that also, with diabetes also we notice that if it's a man, then he's completely relying on his wife to, she'll prepare separate
True.
food for me. She'll do. I mean, women, men, everyone are working these days, right? In addition to doing that, taking care of children, then you expect 2 separate meals to be cooked. You know, to take accountability for yourself. Like if something is important to you, make sure that it happens. Don't. It is very easy to place the blame on someone else, but to say that, okay, it didn't work out because I slipped up on this, that is, I think, one of the hardest things. And I think it's just probably be positive, because like it seems like there's no option, and it's so bleak, but it's just about that, is the glass half full or half empty? And it's just happier and more peaceful if you can see it as half full rather than half empty.
Thank you, Nupur. And But this has been such an interesting discussion. Thank you both so much. I would now like to open it up to the
One point,
audience. Shubha, you have anything to say? Yeah,
one point.
sure.
Feeling gratitude for your donor, feeling gratitude for the family who's been with you also helps a lot to stay positive. At least for them, I'm going to be like, for me, it is, I have to see my child grow up. These people have done so much. I have to do something about it. So, not about
And
me.
this gives you hope. है ना, Shubha? This gives you hope. This keeps pushing you.
So, hold on to that. Hold on to that.
True. Even on couple of days when I mean, I'm not much of an exercise person or, very pro fitness sort of a thing. Pretty much lazy. But I know that I have to keep doing these exercises, just push myself, make sure that, that I know that diabetes is something that is looming. I take steroids as well. So we have to be cognizant of this and at least thrice a week or so take up some sort of a fitness, whatever, the dance ho, Zumba ho, yeah, yoga ho, fitness sort of a thing. So these are very important. Yes, Shubha?
So, post transplant diabetes people are more prone for cardiovascular diseases. And
Yeah.
more cardiovascular diseases has its own problems.
Challenges.
Yeah, challenges.
Hmm.
So my request to everybody is, other than apart from the dietary modification and the medications, if you do exercise every day for at least 4 to 5 days a week for 30 to 40 minutes, and it should be something that is sustainable. Don't go in for to a gym, do gym exercises for 3 months and then you stop it. No, just walking, cycling, swimming. If you're not swimming, again for us it's a little problematic.
Recipient swimming is an issue.
Aerobics, yeah, aerobics. So all these things, if you keep something which is sustainable, will reduce your medication and also help you with managing your diabetes much better post and helpful for delaying those cardiovascular diseases.
Correct.
Cardiovascular disease is very common with post transplant diabetes.
I will now request you guys to unmute yourself and ask any questions or anything that you wish to share. Anant, I can see you've unmuted yourself. Welcome,
Yeah,
Anant.
so yeah,
If you
thanks,
want to
Chair,
say
and
something.
thanks, panel. I'm audible?
Yes, you are.
Yeah, a great, I think, last 40, 45 minutes, a great insight and a lot of information. Personally, I got. I knew that, I mean, I'm also a recipient and taking steroids. Last 4 years back, I had a transplant. Touch wood, so far, all good. I have one question to Dr. Nupur. I know you have been last 20 years as a recipient. So when we talk about diabetics, right? So
Anand,
uh,
Shubha is a recipient. Nupur copes with type 1 diabetes, just to clarify.
okay, sorry. Okay. So I just want to understand. Sometimes what we see, or even my friends when they go and check, yeah. So we do have a pre-diabetics post. I mean, before empty stomach and have post, right? And sometimes it comes above the range, yeah. And then is it something which you need to worry for a 1 month or two if it is more, or it is a sustainable pattern of a quarter or so? It is higher, be it a pre or a post. I know that both pre also should not be more and post also should not be more. But what I've seen is some cases it reverts back. Yeah, because why I'm asking this is, in my corporate, I do see interact with my colleagues, and they do come and discuss, and we also have one kind of a yellow circle, not a basically yellow circle, where we discuss about ongoing issues, ongoing, beat any topic on it. Yeah. So obvious doctors will take decision, we will tell that, but a casual talk when we have it. So my question is it something, if something after 2 or 3 months it is back to normal, do we need to worry about it, or still we need to monitor it for 6 months or so, and continue doing that on diabetes person, say.
Nupur, you want to take that? Or did you want Shubha to speak, Anand?
Yeah, I mean, anyone. I just need to get an answer. So I hope my question is clear, right? So
Nupur?
Yeah, sure. I'll just add in a quick two bit, and then of course, Dr. Shubha, I think her like medical thing would be really
Insights.
helpful. I do think that it's firstly it's good that you're checking often, Anand, and that if sometime it goes high or it comes back, I think one is to be open, like Dr. Shubha was mentioning earlier, that to be open to the idea of sometimes we tend to fight it, right? Like she mentioned earlier that I'll manage with diet and exercise alone, but there might come a time when you might need the support of oral medication or insulin, and to be open to it, because you're at the end of the day the goal is to keep your blood sugars to maintain normoglycemia more than anything else. It's not a personal failure, it's just it's just your body, and to support it. But over to Dr. Shubha.
Yeah, hello Anand. If you had your post-meal blood sugars high, I think you need to be a little more alert. Uh,
Okay. Hmm.
how many times have you checked this post-meal blood sugars?
Maybe 2 or 3 times. It was once 80 and 190 sometime, if I recollect. But then, yeah, but then sometimes it also 130 and 140, or so that, yeah.
So, if you think that you are being a post-transplant person, I think you should get your HbA1c level. Now, that is also an indicator. So,
Mm.
HbA1c level for post-transplant diabetes has to be more than 6.5.
Okay.
And for post-transplant diabetes, all the diabetes should make sure that their HbA1c is never less than 6.
Okay.
That's a very important point post-trans. That's how it differs from the normal
Mm. Mm.
normal
Mm.
diabetes. So if
Mm.
it's more than 6.5, I think you
Mm.
should go and speak to an endocrinologist, because
Okay.
there's nothing to worry. Nothing happens in the
Mm.
next 5 years, 6 years, but
Mm. Mm.
or
Down the
maybe,
line, yeah.
yeah, down
Mm.
the line,
Yeah.
nutritionist is better, or maybe you should step up your exercises. And the reason is post-transplant diabetes, as I said, leads to one major complication, that is the cardiovascular diseases. And apart from
Okay.
that, of
Mm.
course, rest of that there are many more complications, but they don't come up so fast. But these, like the retinopathy, nephropathy, and all, they took years to come. But cardiovascular diseases pop up because I don't know your age. So if you are in your 40s and all, and a post transplant with a little high sugar, I think if you manage it, it will be better. I'll tell you one very good incident. I had gone to a bank, and in that bank there was a bank manager who was looking up his blood sugars. So I just started talking to him. So he says, "You know what, madam? When you are diagnosed as a diabetic, even if you're taking one medicine, it hits you. You become so fit and so conscious of your disease and your health that you for a long term it's a better that a person people used to say it's better to be hypertensive given a choice lifestyle diseases after 40. It's better to be hypertensive because only one pill you have to take. So he says no,
Mm.
diabetic actually you tend to be very conscious of your diet, you tend to be very conscious of you modify your diet, you modify your lifestyle,
Mm.
but better person physically, and health wise also.
Mm.
Try that, get
Mm.
your HbA1c level, and don't think that diabetes is something which I should
Understood. Mm.
keep it
Mm.
away and not. Sometimes, the fear of seeing another
Shubha,
diet.
there is also this feeling, a lot of the people feel कि एक बार दवाई डायबिटीज की शुरू कर दी तो उस पर जिंदगी भर लेना ही पड़ेगा. तो
Mm.
इसलिए
Mm.
many a time because of that attitude they try to postpone not taking the medication, you know. I've
Yeah.
very commonly come across
Yes.
this.
Not
Very
post-transplant
true. Mm.
diabetes. Not
Yeah.
post-transplant diabetes. So that's the first question. I love that question, the complexity of post-transplant diabetes. Because you're going to go on see, steroids are not going to be stopped. So I told you how the steroid affects it. And then immunosuppressants are not going to be stopped. They may be modified but never stopped. So you are not going to have your beta cells in the optimal level that normal person has, and you are not the gates of your muscle and the adipose tissue are not going to be opened. These steroids block it, so you are going to have hyperglycemia. So check
Got
it
it.
up,
Mm.
and that will change your lifestyle. That's the most important thing, and it will help your kidney also. So
Yeah, I
the
mean, few changes, as you said, doctor, few changes I had made. Earlier, I used to just walk and jog, but now I started badminton from last year or so. That is also helping me. So what I usually do is I calculate the calories burn. But considering I'm a South Indian, same, like rice and chapati and carbohydrate more. So I had also talked with dietitian and, a little bit of proteins. I'm taking more dal and so on and so forth. But yeah, sometimes, if I want to eat a Mysore pak, then I calculate, okay, how much calories it is. And in case if I have it, then have I go for an extra walk or something. But still, I wanted to understand, if it is continuously, have more side, it's better to, as you said, so monitor it. If it H1B1 is more than 6, it's 6 or 6.5, it's better to, on a continuous note, it's better to show a doctor, right? That's the key message, right?
Level down.
It should be. All right. Thank you.
One more point I would like to tell all the non-vegetarians. So you cannot have, usually they prefer the post-transplant diabetes, or people tend to increase their proteins. So you can have egg, but egg yolk, you can only have it twice, because post-transplant, because of the steroid and because of the we are also have a dyslipidemia. So and second thing is, the other non-veg, chicken is preferred, fish is preferred, and that too only twice. Red meat, all those things are not preferred, because meat is not preferred, because they secrete some toxins which are excreted by kidney. So it is little harmful. So the toxins can be harmful when you're only having one draft kidney, can harm your kidneys. So with non-veg, you can have fish, you can have chicken, and because to increase your protein. And second thing is, vegetarian protein is more than enough for a post-transplant diabetic for dietary modification. But if you want to have non-veg, it's chicken and fish twice a week.
Just wanted to also ask Anant, if you have if not, you could consider having a glucometer at home. Sometimes the patients, they go to a lab and you end up spending more at a lab to do fasting PP. It's a lot easy to keep a glucometer at home and quickly check pre and post, I mean, post meal, especially. And I remember you mentioned sometimes it's 130 post meal and sometimes it's 190. So what really helps is to, make a note of what you ate, and keep a record, either keep a notebook, or if you're open to
Understood.
technology, use an app, and then compare what spiked you. Like, suppose I have a ragi roti or something, that's definitely going to spike me a lot because it's got a very high carbohydrate
High
content.
carbohydrates.
Yeah, but if I have
Got
like
it.
besan chilla or something, it might not spike that much. So then you can pick and choose those meals which don't spike you much.
Got your point. Yeah.
Once you get
Thank you.
diagnosed, you can do all these things. First, get your diagnosis done. I don't think you're
Sure.
still in the range of diabetic range.
Yeah.
So you
Yeah.
may
Sure.
develop it.
Yeah.
You may be pre-diabetic, but not still. Yeah.
Got it. Yeah. Yeah. Thank you.
The next question is from Siddhant. Siddhant, do you want to unmute yourself and also share, are you a recipient or no, not a recipient? If you could just share. So Siddhant has written, I want to learn more about disease management in the context of diabetes. Can you please guide me on where I can start, assuming I know nothing?
So I'm not a recipient. Actually, I'm more of a. I was earlier on a wait list for a heart lung transplant, but anyhow, I have now potentially developed pre-diabetes, and I just want to learn how I can manage it proactively and maybe not. Uh, I mean, I hope it does not develop into diabetes. So, what steps I can take to manage it?
Anybody? Dr. Shubha? Nupur?
Yeah, happy to start. Like, Dr. Shubha was just mentioning, get your HbA1c checked every 3 months. I know you mentioned you're not a recipient, but I think maybe, and Dr. Shubha, correct me if I'm wrong, but no harm in regularly testing. At least that way, you're on track. And if your parameters are all within range, and also like good to kind of have a healthy diet and see what works. Like, I know, because I'm testing often, I know that this particular food will spike my sugars, and this one maybe won't spike as much. So then I make those choices based on the data that I see, on my CGM or my glucometer. But yeah, Dr. Shubha.
So I'm sorry, Siddhant, I didn't get it. Are you a recipient?
No, he's not a
Uh,
recipient,
Okay.
but he's
So
at a
you're waiting.
pre-diabetic level.
Yeah, you're waiting for. Yeah. So this is a very interesting. So you don't have a kidney problem. You only have a heart and lung problem, no?
Right.
Yeah, okay, okay. Send them. So I think you must be getting your tests done every month or maybe every 15 days or something. How
So
often do you do your tests?
actually, I came to know just a month back. So 15 days, I have done 2 tests.
Okay.
You came to
So,
know? I didn't get.
Just a month back.
Ah, okay. Oh, okay. So no, the tests related to your heart and lung. Whenever you do your tests, so during that time, just get an HbA1c done after about 1.5 months, and then the next one after 3 months. That would be a very good indicator whether you are a diabetic or a pre-diabetic. So you have these values. Anyone below 5.7, 5.7, yeah, 5.7 and above is a pre-diabetic up to 6. 6 and above she can also be considered. Now I don't remember the normal diabetic range. I only remember the post-transplant diabetic ranges. So anything above 6.2 is diabetes. Okay, anything anywhere between 5.7 to 6. Now, again, small variation will be there from lab to lab. So just check the ranges. If you come under pre-diabetic range, then your dietary modification and lifestyle modification is difficult now with you waiting for a transplant. But dietary modification can help.
So like I wanted to understand like is there some resource or somewhere which I can refer to understand things like learn by myself and understand.
About diabetes,
Yes.
no, the diet management and
Yeah, all
all of
kind of
that.
management and the
you can go to a nutritionist for that about how to take low carb. Nupur will be very helpful for you, especially she speaks a lot about, I think, low carb and all, isn't it, Nupur?
Yeah.
Yeah.
I've personally found low carb very useful for me, and my HbA1c as a diabetic many years back was also around 9 and 10 and all, which is extremely high, very dangerous, and it impacts all the organs and everything. But now with low carb, quite easily I'm able to maintain an HbA1c around between 5.5 to 5 to 6. And of course, there's a lot of blood sugar checking. There's a lot of that, but I'm happy to feel free to reach out to me. I'm on like you'll find me on social media or anything. There are also blogs that are written by patients, and if it's okay, Jaya, I can maybe share a
Of
link.
course.
So there's
Yes.
a lot of self learning that is needed, and I think I want to congratulate you for wanting to get started. When you need help, of course you should 100% visit a professional, get that help. But in the meanwhile, I think it's good to see and learn, at least get a sense
आवाज का नहीं था
yeah.
Sorry. Nupur, do you also have any recommended content, like diet and all of these, the ones which you think, yes, this makes sense, this works. Any recommendations on that?
Yes, so we have a section on the so we have this blog that we have at Blue Circle, and on the blog you will see different tags, so some one will be about food, one will be about reviews for technology related to diabetes and other things. But on the food section, you'll be able to see different blogs of people that have had experiences with different types of food and diets and whatnot, and people also discuss these amongst themselves on our Facebook group. So people asking each other constantly, I ate this, it spiked this much, so on and so forth. So there's a lot of back and forth learning and unlearning. I can say even for myself that for the first 15 to 18 years or almost 20 years, I had very bare minimum knowledge and didn't know, even though I had diabetes for so long, I didn't know anything. So it's really nice, that if from before you get it, if you're aware about it, it's very proactive. That's really good because many of us have suffered unnecessarily, by not knowing or by not paying attention.
Mhm.
Anybody else? Yeah, there is Nupur shared this. What I'll do is I'll also post it in our groups so that we can refer to it after this meeting also. Anybody else? Any other questions? Thank you, Siddhant. If there are no more questions, then it's been more than an hour already. So we will then end this discussion. Thank you both, Shubha as well as Nupur, for being so honest and generous with your insights and experiences. You've shown us that while diabetes may be lifelong, but so is the capacity to adapt with it, grow, and take lead in self-care. So we hope that everybody here leaves with some practical tools and renewed energy to face their own journeys and path. So thank you so much, Shubha. Thank you, Nupur. Thanks to each and every one of you for joining. Thanks to the Thank you, Prashant. Prashant has a last minute question. Thank you, Anant. Prashant, I will ask them and then I will convey you. So thank you so much, Shubha. Thank you, Nupur.
Thank you, Jaya. Thank you, Dr. Shubha. Thanks, everyone. Bye.